Yeah.
Okay, got it. And then you might want to put yours on presentation mode so we just see the slide.
So welcome to our Faith Community Nurse Program monthly chat. We're going to start our programming with our opening reflection.
Okay, thank you. Thank you, Lucia, and thank you for organizing our monthly report for May. We are continuing with our mental health series, and so I would like to welcome our guests, especially our guest presentation presenter. And as we continue with this mental health series, I want to focus a little bit on our core purpose as faith community nurses. And that is summed up as care of the spirit. And so often we feel as if everything just rests on our shoulders. But in fact, that's not always the case. And it is helpful for us to be able to put our trust and faith in God. At the end of the presentation, if we have time, we're going to play a song that illustrates and resounds that theme of placing our trust in God. But as nurses, we know that no matter how much faith or how much we trust in God and how much we deliver to Him all of our trials and tribulations, it does not eliminate in any way the anxiety, the stress, and the responsibility of our practice. And so it is with great pleasure that today we're going to put into practice a little bit of the nursing process and assessing and our signs of observation as it relates to our own self-care and being able to recognize those signs of stress, whether we're coping or not with our responsibilities of our practice. And then also looking at a strategy for coping, having a self-care plan in place, and then always rechecking and reevaluating. So what I'd like to share most of all with you is that it is helpful to remember that one pair of hands form the mountain, one pair of hands form the sea, one pair of hands made the sun and the moon, every bird, every flower, every tree, and one pair of hands formed the valleys, the oceans, the rivers, and the sand. Those hands are so strong when life goes wrong. Put your faith in the one pair of hands. One pair of hands healed the sick. One pair of hands raised the dead. One pair of hands calmed the raging storm, and thousands of people were fed. One pair of hands said, I love you, and those hands were nailed to a tree. Those hands are so strong, so when life goes wrong, put your faith into one pair of hands. One pair of hands. And as I mentioned in the beginning, we sometimes feel that our hands are the only ones that we have to work and to bring about the outcomes that we would like in our practice. And so to keep in mind that our Lord, in sharing His hands with us, also gave us so many others who help us on the way. And so at this point, I'm going to turn the program over to Lucia to introduce our speaker to help us with just that. Lucia?
Yes, so hi, everybody. I wanted to introduce Nicoletta Piccardo. She is the principal of Navigo International Coaching Institute. She holds a master's in education and counseling, is a PCC certified professional coach, member of International Coaching Federation, certified in change leadership, and a master neurolinguistic practitioner. Her awesome clients are individuals, associations, government agencies, and international organizations. While they vary dramatically, what they share in common is an unquenchable thirst for more freedom, impact, and self-expression. When she's not at work, you can find her with her three amazing children, taking Zumba classes, traveling, or hiking the Appalachian Trail. Welcome, Nikki. And let me switch the presentations.
It is a pleasure for me to be here with you. And as you might hear, I am a little bit health challenged this morning. or this afternoon, I should say. So my apologies in advance for any strange sounding speaking. That's just because I'm having a cough lodgings in my mouth right now, and I don't normally do that. I'm delighted to be here because this is such an important conversation. When Lucia asked me to talk about mental health, particularly for a supportive communities such as nursing, I immediately said yes, because this is one of those things that we don't talk about as much as I believe we should. So anytime you're ready, you can start the presentation, Lucia. There was a recent study that talked about nursing and wellness and came up with a 54% of nurses who had mental health and physical health challenges. Now, the numbers vary depending on the study, but particularly nurses, frontline healthcare workers, have always had a huge amount of stress and pressure to deal with, and COVID has not made these things lighter. Today, and I'm not sure, Lucia, are you able to share the?
I'm not able to open the file, Nikki. It's in .key format.
I see. Okay. Well, we'll do it without. Rather than spend some time, I am happy to, what I can do is at the end, do you share the files?
Yeah.
So I would love to share the file with you. I think rather than spending time on that now, we'll just do the presentation without the files, and then I'll send that to Lucia and you can add it. How does that sound? Is that all right if we do it that way?
Thank you.
Okay. So like I said, mental health is an important issue, and it doesn't matter the studies we look at. What we do notice that it is a topic that's not spoken about as much. The result is overwhelm, burnout, and we can look at loss of productivity, from a company standard, but we can also see that it impacts relationships, erosion of family life, and who we are as a person when we're suffering with chronic stress and overwhelm. So my name is Nicoletta Piccardo, and as Lucia also already said, I have a background in counseling. So I have my BA in psychology, my master's in counseling, but I didn't start out that way. I actually started out on the journey of becoming a physician. My mom wanted me to be a doctor, and it was in an internship that I did in the cardiac floor that I really discovered that my path was to support the mind, not the body. I would sit with cardiac patients way too long. The physicians would come and say, hurry, let's go. And here I was sitting with the patients, holding their hands, listening to their journeys. And the one thing that really stood out for me is that there were some patients that were really, really, really ill, that everyone knew they would not be walking out of the hospital, but they were in good spirits. It was almost like they were grounded and they were okay. And then there were those patients that were, there for 24-hour observation. Everyone knew they would be walking out the hospital, but there was this doom and gloom. And this got me really, really interested. What's the difference? It was certainly not the diagnosis, because the diagnosis had sometimes very little to do with the way patients were experiencing their current status. And that's what got me to pivot into psychology. Spent my undergraduate time working on anxiety disorders, did several more internships in psychiatric hospitals, and really dove into supporting individuals firstly in counseling, and then 10, 12 years ago now through professional coaching. That's allowed me to take my counseling, build on more solution and forward thinking, so that I can now help my clients really reach some of those goals and milestones seemed out of reach. Today, we're going to have 3 outcomes, because we're going to talk about some of the myths of mental health, because there are lots and lots of myths. And now I know in nursing, you know all of these things, but I think sometimes we just have to slow down and remember, because they're so easy to get wrapped up and get on the fast-paced interstate of life. So we're going to talk about gaining some awareness of mental health myths. We're going to talk about some of the warning signs to look for, some of the easily missed ones, and then how to have a plan so that we can support each other. Because sometimes, especially as we are purpose-driven, as we are supporting professionals, it's so easy to forget to support ourselves and to support some of the people that are in our community. So let's start with some of the myths. Myth number one that I hear a lot: self-care is selfish. Who's heard that before? Right? And we talk about self-care when we talk about mental health, because self-care is so important for us to stay mentally fit and mentally healthy. Self-care is not selfish. It is one of the biggest myths that I hear when people say, well, I don't have time for counseling. I don't have time for coaching. Anyway, I don't want to put myself first. It's the family, it's the patients, it's the community. Self-care is not selfish. Self-care is something that we all have to do because we can only give from a cup that is full. Myth number two: self-care is something you do when you have time. Who's ever said, oh, yeah, I know, I'll do that meditation or the yoga, whatever. Now, I would also ask you, who brushes their teeth every day? Who brushes their teeth every day? Okay, we have time for that. We have time for self-care. Sometimes there's this belief that we need to have, 2 hours every day for self-care, and we don't. We just need to make sure that we have it as a habit. Self-care is something that you do every single day, not just when you have time once a year in a vacation. Myth number three: self-care is only for those people who really need it. Who's ever heard that before? Self-care is only for people who really need it. We all need it. Absolutely a myth. Self-care is something we all need, we all deserve, and especially when we are givers. I work a lot with purpose-driven individuals who are nurses, doctors, who are therapeutic massages, people who are giving. And when you're giving a lot, you need to make sure that you're replenishing. When you get to that point where you're feeling that you have to, you're already very depleted. It's like your tank in your car and the reserve light is going on. So it's not just when you really need it, it should be on an ongoing basis. And lastly, the one that I hear a lot of: when you ask for help, that's a sign of weakness. Asking for help is a sign of weakness. Well, I hear a lot of shoulds. I should be able to help myself in this situation. I'm helping people all the time. I should be able to help myself on this. Maybe you've heard that before. Also, absolutely a myth. It's a little bit like saying I have a UTI and I'll just get over it. It'll be fine. I don't need to ask for help. Well-being, mental health, it takes courage to ask for that support. It takes courage to go and seek some guidance. It takes courage often because it might feel risky. It might feel vulnerable. So asking for help is a sign of strength and a sign for courage. And before I move on, I just want to hear some of the things perhaps that you've heard when it comes to asking for help and well-being.
Nikki, I want to say real quick that you should have access to share now.
Okay. Let me see. Natalia, are you seeing my presentation now?
Yeah, we see your screen and the window in the back with the myths. Yep, there we go.
Is this
perfect?
Okay, so I'm not quite sure. I don't seem to be able to see what you're seeing, so I'm not sure what it is that you're seeing right now. Let me get my...
So if you click on the window of the myths, we'll see that.
Okay, dann drücken.
Yep, perfect. We see the presentation.
Okay. So I can't see any responses from you guys. So it's like I'm flying blind. So you'll just have to really let me know how things are going for you.
I can guide you if I see somebody raising their hands.
So the question I have for you is, what else have you heard when it comes to mental health and asking for help? Or reasons for not getting support?
And you can just unmute yourselves.
Yes, please just unmute yourself. Don't put it in the chat because all I right now can see is my screen here.
Betty? You have to unmute yourself, Betty.
Asking for help is a role reversal, and some of us have trouble turning one role off and turning our person role on.
Yes, yes, absolutely. Thank you for sharing that, Betty, because that's exactly what we're going to be talking about, actually. That one of the challenges that we have are all the masks that we're wearing. And you called it a role. I like to call them masks. When you think about who you are for your kids, you wear the mask of a parent. You will ask different questions. You might give some more guidance. Probably you're not going to share your deepest challenges with your 10-year-old. You might show up very differently with your significant other and share different experiences in life. We wear the mask of a parent, of a significant other, and we wear lots and lots of those roles in life. Now, when we go to work, again, I work a lot with purpose-driven professionals. We tend to be big givers. That means giving is oftentimes what brought us into the profession that we're in. So we wear that mask of a giver. Sometimes, though, what is the most important mask for us to wear is the mask of truth and vulnerability. And that can be the scariest and the riskiest mask for us to wear, because it just means it's us. We are allowing ourselves to take everything off. I'd like to share with you a story of a client that I worked with, because I think it'll be a nice way for you to learn a little bit about what this kind of support can look like. Now, in 2020, when the pandemic started, I started an initiative called Coaches Against Corona. We had 120 coaches, certified coaches, that were providing completely free mental health support to clients, nurses, doctors, healthcare providers, just to help them feel supported with coaching sessions like this, stress management, overwhelm, just venting sessions even, so that they could go home and then be with their family if they were able to go home. So that's how important this topic is. One of the clients that I worked with and have worked with, and she was actually a little bit later, and we're going to just call her Kim. She was a nurse who got into nursing because she really, really, really wanted to help people. That was her drive. She really wanted to support and help. She was very quickly identified as a superstar. Now, this was not, this was in a different state, big hospital system. Very quickly, management said she can do a lot more. So very quickly, she started rising in the system, and the hospital system went from nursing into management. By the time she and I worked together, she was managing the pharmacy, where that was chronically didn't have the medications that were needed. She was also managing the staffing, which she said wasn't sure how she was going to cover all the shifts with the few nurses that she had. And because she was doing such an amazing job, management was pushing her even further up. At work, she was the star. However, what nobody saw was that she was really exhausted. Sometimes on her way home, would sit in her parking garage and just stoically sit there and not be able to even get out of the car because she felt so exhausted. The relationship with her significant other really suffered. They were almost not seeing each other anymore. And really all areas of her life were impacted. Now, no one at work really saw this because she was a superstar. She was really rising very quickly. She hadn't been working out, even though that was a core value of hers for a long time. She wasn't cooking anymore, which was actually causing her to be in this spiral because she was a nurse. She knew how important it was. She wasn't cooking anymore, so she was eating a lot of junk food and fast food, not saving the money that she wanted. So it was causing this extra spiral of, I'm not doing a good job, that self-talk that was starting to set in. I'm not doing a good job. I know I should. I know I ought to, but I can't. She was really exhausted. And nobody really saw this except for her supervisor. He was noticing a few changes in her, very, very, very subtle. Now, I know in the nursing profession, we know what to look for when it comes to mental health, but sometimes it's a good reminder to just reconnect with what it is that we're really looking for, because we go so fast. It's a little bit like driving on the Autobahn. I'm originally from Germany. You get on the Autobahn there and you go fast. And that's how life is sometimes. We go fast, which gets us to do a lot of things. The challenge is that we miss the exits sometimes. We miss the important things that are on the left and the right. So sometimes we need to just slow things down and reevaluate and relook. So, so here are some of the things that we want to look for. And then I'll share more about Kim, because there are 3 areas for mental health that we really want to keep in mind. It's one time the physical, it's the psychological, or thinking about life, and it's our behavior. Those are the 3 key areas we can look at to see if something is going on with somebody in our life or in our community. The physical changes can be very, very subtle. They can be weight gain or weight loss. Sometimes clammy hands. I know we're not shaking hands the way we used to, but sometimes the clammy hands can be a sign of anxiety, depression, even post-traumatic stress, or some of the key mental challenges that are faced in the nursing profession. Physical pains, unexplained headaches, backaches. Our body reflects our emotions and vice versa. Emotion is created by motion, and the same is true of the way we use our body. I mean, if I ask you, what does a depressed patient look like just physically, you are able to describe that, the way we use our body. So we can really look at where are the shoulders, how fast is someone walking, and really look and listen for changes. That's a key. Now, I don't have to say this here. This is not like a checklist, but this is something to keep in mind. In Kim's case, she was actually exhibiting a lot of the opposite, like hyperdrive, really, was displaying almost like a lack of sleep. She was going all the time. She was not in, I would say not in a good mood, but this, like almost a fake kind of, yes, absolutely, we can do this. Let's do this. Very fast paced, almost on the opposite spectrum of what we think of when we think of mental health. The psychologicals can be the most subtle because we don't share those. Most people hold those in of how we feel, especially when we're busy. We don't typically share how overwhelmed. Certainly Kim didn't share this with anyone. Somebody said it here earlier. We get that sense of that we are the ones that have to support others. I can't now be in the role of being supported. So that sense of those thinking thoughts of feeling sad, worrying, fear, extreme fear, fear of, in Kim's case, she was afraid of losing her job. She was afraid of losing her boyfriend. She was afraid of letting her family down. She had so many fears, and they were exaggerated. We all have fears, but they were just exaggerated. Feelings of guiltiness, certainly if there are circumstances that have transpired where maybe something didn't go as we planned, revisiting that a lot. So you'll notice somebody who keeps talking about the same thing over and over, there might be something there that they really need some help working through. And feeling numb. In Kim's case, she told me, I feel guilty because I don't care anymore. I really don't care. It was almost like she was faking it just to get through it. What she was really feeling was numbness. And the last are behavioral changes. Now, when we get busy, of course we change our behaviors and might not go to as many social functions. Our sleeping might change. But here were some other subtle things. In Kim's case, she loved her fingernails. And one of the things that her supervisor noticed is that she wasn't doing her fingernails anymore. Subtle, very subtle. In fact, they actually looked like they were neglected. And that was a sign for him to pay attention, because he, excuse me, he noticed that instead of having the little cute flowers and instead of having the cute designs on her fingernails, they were chipping. Some of the fingernails had fallen off. Very subtle, actually. But he noticed that, and that was a sign for him to see, what other things. Maybe the hair wasn't quite done the way that she always had. Calling in sick a lot, or simply not showing up. And now that was not the case in Kim's because she felt so responsible. When we are in helping professions, one of the things that we do is we give a lot. And there's almost this belief that we have to give to others a lot more than we give to ourselves. Now, if you have kids, I would say, when is that the advice that you would give to your daughter or son? Take care of others and don't take care of yourself. But somehow that's the belief we've taken on. So what do? In communities, the key is for us to have a plan. When we do feel that there's somebody who has a mental health challenge, to slow things down and approach it with a plan. It's a much better approach to take somebody aside, have a private conversation. Sometimes we feel like that has to be a conversation that's really long. That's, a conversation where you pull them aside and you need the 15 minutes. We're going to do an exercise here at the end, because how you show up for the conversation can have a lot of impact in the way the conversation goes. But first and foremost, make sure that you pull that person aside. It could be a little doorway. It could be, it could be a little side crevice somewhere. Don't make it in the hallway where everybody is standing. And just remember, mental illness, whether that's depression, anxiety, maybe overwhelm, stress, it is not a choice. It is something that the person is dealing with. Leave space and freedom for self-expression. Sometimes we feel so uncomfortable, or our mind might be in that diagnosing, okay, let me check everything off, that the conversation doesn't feel free. So make sure that you're slowing it down, that allows the other person to have the freedom to really express what's going on. And bring some prompts in there about mental health. Sometimes we start the conversation, hey, so everything okay? And the person says, yeah, everything is fine. So what we want to do instead is really slow down and open the dialogue about feeling sad, about feeling like things are getting too much. You get to be that person who has that conversation and creates that space. Now, I brought some open questions, because ask open questions, get curious, and actually trigger the person to reflect on their overall well-being. Normally we say don't trigger anyone. Of course, we want to stay away from that. And this is different. We really want to trigger that person. Remember, their mask is usually on, I got to get through this. So what are you noticing? What are some things that you can say that'll actually trigger that person to slow down and talk about their well-being? Maybe if you know something about the person, that they're always very caring, and you've noticed that they haven't been asking a lot of questions. Ask them and say, hey, I wonder if you're still caring as much as you used to. Often our own discomfort gets in the way of asking that person a question, but only when we are willing to take the risk to get a little bit uncomfortable are we allowing the other person to do the same. And you always want to wrap up the conversation with next steps. So, maybe the person has said, no, everything is fine, but there's a sense for you that things are not fine. Things are your gut feeling. I'm going to say, trust yourself on this. Listen to your inner guidance, your inner voice. If something doesn't feel right, then don't let it go. It's better to have somebody be a little bit upset with you because you are insisting on their wellness, because maybe they just can't see it or they're not ready to lean in, than to look back and say, oh, if only I had stepped in. So you always want to have a plan and always leave the conversation with next step. The person might say, I'm fine, I don't need anything. You might just say, would it be okay if I checked in with you next week? Or how would it be if you texted me in just a couple of days? I really care about you. So always make sure that you have something at the end to let them know that you're there for them. Sometimes that one conversation can be that one pivotal shift. In Kim's situation, that's exactly what happened. Her supervisor spoke with her and told her he was noticing the fingernails. He was noticing how she was acting a lot more intense at work, and told her that he thought maybe working with somebody might be helpful for her. We connected, and one of the things that she noticed, that she really needed some help putting in some healthy boundaries, that she didn't need to make herself available 25 hours out of the 8 days a week, which was above and beyond expectations. She really started to have some new habits and some new wellness routines that allowed her to regain some control. But it wasn't just something that she decided to do. It was because somebody stepped in, noticed some of the details, had the conversation, connected us, and that's how she was able to create the pivot. Now, I want to leave you with a couple of questions, because sometimes when we're in the fast lane work mode and the diagnosing and getting things done mode, we aren't as creative as we could be. I mentioned with you to be creative in the conversation. So here are things that you might say. Tell me how you felt after it didn't go so well with that patient. Or I'm wondering if, all this work that you're doing is causing a lot of stress for you. Or you might even share something like, if I were in this situation, oh my goodness, I would feel so overwhelmed. I wonder how that's showing up for you. Again, what we want to do is create some connection. And this is not just the connection that we do when we're really in the routine of delivering service, but this is really slowing things down. I'm going to share with you an exercise for us to do together so that when we go into a conversation, oops, let me close that off, so that when we go into a conversation, we can feel more grounded, we can feel more ready to have that conversation. Because a lot of how that conversation is going to go is how you show up for that conversation. So this is a very quick exercise. I'm all about tools that you can use in the moment, and perhaps you've heard of it already. It's called 4-7-8 breathing. So I might not follow along as deeply as I normally do today, but we're going to inhale through our nose to a count of 4, hold our breath to count of 7, and then exhale to count of 8. Now, what I would also encourage you to do is to get in a more of a comfortable but powerful pose. Notice when we're in stress and overwhelm, and by the way, stress is just another word for fear. Our shoulders tend to be hunched forward. We're already telling our body, oh, it's too much. So when we do this, we want to get ourselves, if you're standing hip width apart, you can do this even in the grocery store. In the grocery store. So we were going to just gently roll our shoulders back, and we're going to inhale to a count of 4 through our nose. We're going to hold our breath to a count of 7. And exhale through our mouth to a count of 8. You can do this a couple of times. Inhaling, it changes the speed in the diaphragm, which causes us to just relax a little bit more. It's called 4-7-8 breathing. So in through 4. So before you have this conversation and you're going go fast, 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 just allow yourself. And you can do this pushing a cart. You can do this in the bathroom, and maybe do 2 or 3 rounds of this 4-7-8 breathing, just to ground yourself so that you can be fully present in the conversation. There's one other move that I'd like, or tool that I want to share with you, and that is to give yourself some space and confidence. And it's actually 2 things. If you want to just reach out your arm like this, now this might feel a little bit, again, rolling it back, and notice how that feels very different. It's sort of openness. It's sometimes people tell me it feels very uncomfortable. You feel vulnerable. But again, it changes. We can use our body to shift our emotions. And it, just look up a little bit, increase our confidence a little bit. We're about ready to have an impactful conversation with somebody that might be uncomfortable for us. So we want to get ours, and feel free to put your hands down. You can also do the so-called Superwoman Pose, which is the standing hip width. Lucia, maybe you've done it. The legs hip width apart. We want to put our arms here and just look up like Superwoman, and do that for about, exactly. Just look up for 2 minutes or so. You can do this in a bathroom stall. You can do this at Macy's in the changing room. And our body can be a very quick tool to shift. And I see some smiling, right? And there's nothing wrong with being playful. Be playful, because it shifts the way. And when you show up with this sort of energy in the conversation, you're really being the placeholder to have a deeper connection with that individual. So today we covered a lot, and a lot of these are perhaps some of the foundations for you to remember that there are these 3 areas to look for. small, subtle changes can be an indicator for some big things. That as you're having these conversations with other people, make sure that you're putting yourself in a good state first. And these tools that we just shared together, you can use any time that you need a pick me up too. You don't just have to give it for sharing. This is also a tool for you to use so that you can have some deeper connection and sharing. So I always like to round things up by asking, what did you get out of this, and how can you see yourself applying this? And I'll just turn it over back to Lucia as we're wrapping this question up.
Thank you, Nikki. And anybody that wants to share, you can just unmute yourself. Go ahead, Betty.
Thank you so much. That was a wonderful presentation, and it is such a impactful reminder to us that we don't have to be on mode all the time in the giving mode, and being able to give ourselves permission to switch roles. And the other thing I want to mention is how much we receive also in just the process of being open to check in with somebody else, or being open enough to be vulnerable with somebody else, and how deep that connection really is. As a faith community nurse, we're wearing this role all of the time, and it's not always appropriate to share your own story. But I think for all of us, we need to find that space, if we don't already have, of a confidant, a spiritual director, another friend, somebody outside of the work situation and that role that we play, so that we do give ourselves the time, the space, the permission to be our authentic self and be the best version that we can be for others.
Yeah, I think that's a very powerful reminder. And I will just say, sometimes people, as a coach, people say, well, there's nothing wrong with me. I'm not sure if I should be getting a coach. And I always say, it's not about fixing anything. We are already complete, but having that person to support you for growth, so I think that's what you spoke to right now. Thank you for sharing that.
And this is also a good opportunity in case anybody has questions for Nikki. You can also unmute yourself. But I really appreciated, Nikki, the practical aspect of your presentation, and how we approach people, and what are the things we want to watch out for. And thank you also for the questions and how to approach somebody that may be going through something that we're not aware of. So I like the triggering part. I always try to be careful and not to get anybody too emotional or whatnot, but sometimes recognizing this is important.
And that may be, when you trigger them, that may be that first time that they say, yeah, it's really tough right now. It is really tough right now. And that sometimes that can just be like that door opener. And you're right, most of the time we hold back because we don't want to upset anyone. And there's really nothing wrong with any emotion, nothing. I would say emotions are they just share with us what's happening right now. And then there's something we can do with it, but we can't do anything with it if it's all locked away. So yeah, you're right. If we just trigger somebody a little bit, it looks like you're sometimes even just saying, whew, it's been a long week. You look really sleepy. Not something that we would normally say, but somebody might say, I know, I've taken on 4 extra shifts and I'm just exhausted, huh. It does sound like a lot, or,
Nikki, would you talk a little bit about how you approached coaching during COVID? Was this on a virtual platform similar to what we are doing now? And in the phase that we are right now, how is that delivery of coaching shifting for you?
So for me, I was in the digital space before COVID. So this is how I work and present and provide keynotes in the digital world. So my clients have been everywhere. From Germany originally. I live in the greater DC area, but my clients are anywhere where there is internet access. It makes it convenient in the DC area because oftentimes people are really busy, and driving a 50-minute time slot for a 1-hour conversation is just not feasible for many of my clients. It's just, so sometimes if I'm working with a company, they'll have me come in and then I can work with 4 people at a time. I'll stay there for 4 hours and work with one person at a time. But most of my clients, especially individuals, they work with me like this, because then, sometimes they sit in their car if they're really busy at work, or I've had, when I've worked with executives, they close the door, it's their hour. Now, especially during this COVID time, the Coaches Against Corona, that was really my way of supporting the healthcare community, because my stepdad's a doctor, and I know how much work there is in the healthcare already before COVID. And so I do a lot in the coaching community, and instantly I had over 120 coaches that volunteered remote coaching for mental health, wellness, and just to support. So we did that like this. We did it virtually. I'm big on certified coaching. I'm part of the ICF, so that means coaching is confidential. We have the same, it doesn't have quite the HIPAA regulations as a doctor, but it has the same confidentiality clauses as a therapist does. It has the same confidentiality. So when nurses or medical providers sign up, they got a contract. There was no fee for it, but that protected that conversation with the coach, making it confidential and making it a protected
Nikki, Nikki, Becky has to jump off to another call, so I wanted to let her ask her question real quick. Go ahead.
Yeah, thank you. Thank you, Nikki. This has been a wonderful, wonderful presentation. Great points. How do we refer someone to you?
Well, thank you very much. I'm glad you found this helpful. And there's so much. This is such a topic I'm so passionate about. I could keep going and going. I find that the most helpful way is to let the person know. Sometimes when somebody's connected with me and the person that's being connected didn't even know that somebody had them in mind for coaching, that doesn't work. My suggestion is always have a conversation and tell that person, hey, I know someone that supports individuals who are in your kind of life mode, and I think this would be valuable for you to have that conversation. A 3-way email is often best. It can be very scary. It can feel very scary to have that first conversation. It really can. And we don't think about it, especially if we're the givers, to actually sit back and be the receiver of support. So sometimes that 3-way email introduction, it's like you're holding their hand and saying, it's going to be okay. So you're handing that person off. So a 3-way email introduction is really good. And then I will always have a conversation first to make sure that they are a good match. So because I am a coach, I don't do counseling anymore. So if I notice that there's more need for a therapist than there is for a coach, then I have some therapists. So sometimes we work together. The therapist will work on whatever is happening that is requiring therapy, and I'm able to support the person with the coaching component of it. Now, I do have a background in mental health, so when things are present that I've worked with people who have anxiety, I've worked with people who have depression, but I work from a coaching perspective. So I'm very clear to make sure that the individual receives the support that they really need. And we do that assessment in the first conversation. We take our time to make sure I understand what the challenge is, what are they hoping for, so that we can make sure that we're a good match to work together.
Nikki, do you guys will continue this program, Coaches Against Corona, for a while, or how do you?
So this program, actually, we discontinued late last year. Anyone that is interested, all the coaches are still part of my network. It was like instant. I said, hey, we need coaches. This is our way of, I believe in community. When we all help each other, we all help each other. There are other programs. I still have the coaches that are still looking. So if there is a need, I know that, if there's ongoing need for people, so I have to be careful because, of course, coaching is a profession like nursing, like physicians. what we specifically did is to support nurses that were challenged during the COVID pandemic, that were working the extra hours, that couldn't go home. So that was the Coaches Against Corona, was really specifically for that purpose of supporting healthcare providers in that time. Now, if there are nurses who are still in that struggle right now, I know COVID cases are going up again. I know when I was working with Kim, medication shortages and things like that. So that would be something that, I know that I can find some coaches to support. The ICFDC was also putting some free coaching together for nurses. They've taken over the program, so I can help connect with the resources. Now, if there's a nurse who just says, my life is just stressful and I just need, I would just like to work with somebody, then that's a little bit different. Then that would fall in a different category.
Great. And we'll share your information too in the follow-up email. Stephanie, I think I may have seen, thank you, Becky. And Stephanie, I think I may have seen you unmute yourself for a minute. Did you want to ask a question?
No, I was just going to say, just the value of our relationships is, we it reminded me of the values of a relationship. I was thinking back on passage in Exodus 18 where Moses is visited by his father-in-law who brought back his family to him after he had, took the call on of helping the Lord deliver the people from the hands of Egypt and Pharaoh. And he's in his second call judging the people, and his father-in-law observed him doing this, and the Bible says he was sitting there from morning till evening, and the people, were just sitting there waiting in line for his help, and he was the only one doing the job, and so his father-in-law had saw that he could become overwhelmed with this, and the people could be too, so he advised him to find some help, to delegate some of his responsibility to some other men amongst him. And so, I was just thinking about how important relationships are. You talked about asking the question when you see someone is not what, if they don't seem like they're okay, to ask the question, and then just offer some advice or just point them in the right direction as to, how they can help themselves. There were no boundaries and he had no balance. So, and, a lot of times in this situation with the young lady you were talking about, that's what I see as, you said she had a hard time with the boundaries and, just finding that balance, trying to be that superwoman. So relationships are just so important.
Absolutely. Thank you so much for being here, Stephanie, and sharing that. So with that, does anybody else have another question for Nikki? All right, so thank you so much, Nikki, for being our guest today. We really appreciate your presentation. And we'll share your information and the presentations to everybody that attended today.
It was a pleasure being here and sharing this with you, helping to remind everyone how important mental health is. It's not a luxury. It's not something that we do when we have time. We really all deserve to take care of each other and be there and support each other as a community. So thank you for allowing my community, the coaching to come in here and share a little bit about that with your community.
Once again, thank you, Nikki. We really do appreciate your time. I hope your cough leaves you soon.
Yes.
And at this point, I'd like to turn the program over to Janice Perry, who's going to update us on some upcoming events and also lead our closing prayer. So, Janice.
Okay. We have some upcoming events, and for June, I believe it's June 22nd. Yes, Wednesday, June 22nd will be our next FCN chat. It'll be a continuation of our mental health series, and actually it will be our third session. And then that following month, July, we will have our final mental health series session. And that will be held July 27th and Every Mind will be our guest speaker. And as far as the 22nd of June, we will have to announce that speaker to you later. So that, and then the other announcement is that there are mental health first aid trainings available. If you will go to the website, mentalhealthfirstaid.org, they have locations and times listed that you can sign up for. And the training is an 8-hour evidence-based training. It's presented by certified Mental Health USA instructors, and it will teach how to help someone who is developing a mental health problem or experiencing a mental health crisis. And so that's available for registration through their website. So as we move into our closing prayer, please pray along with me. Father of mercies and God of all comfort, who is our help in time of need, we humbly ask that you would visit and relieve those who suffer from mental illnesses. Please look among them with your eyes of mercy and comfort them with the sense of your presence, your mercy, your goodness, and your power of healing. Please, in your good time, restore them to health and enable them to lead the rest of their lives in reverence to you and to your glory. Please sanctify those who have been called to the practice of the healing of body, mind, and spirit, and to, by your life-giving spirit, be your agents for healing and recovery, and that by their ministries, sickness will be turned into health, and that their efforts will be promoted and blessed by your power and might. Through Jesus Christ our Lord, I pray. Amen.
Amen.
Okay. Well, thank you so much, Janice. That wraps up our monthly chat for this month, May. Again, Nikki, thank you so much for sharing this valuable information. And it is certainly a situation where, you know, the pot is calling the kettle black. Sometimes it's always easier to identify something in someone else rather than ourselves. So thank you for that encouragement for self-introspection and reflection and time for ourselves as well. So with that, I think I'm going to sign off. There is a reminder at this point, the recording will end and it will be made available later on our website. Okay. Lucia, any closing thoughts?
No, thank you, everybody. And can you turn the recording off, Betty?
Yes.
Okay. Thank you so much.
Thank you.